Metro Atlanta's fall asthma season typically begins in late summer and stretches into October, but shifts in weather, sudden cool snaps, dry air, or spikes in moisture can trigger flare-ups for a lot of us. So here to help us tackle the sniffles, the sneezes, and the shortness of breath is Dr. Justin Greiwe, an allergist and immunologist connected with Children's Hospital in Cleveland. Welcome. I hope I said your name right. Is it Greiwe? Greiwe, is that correct?
It's Greiwe. It's a tough one.
Greiwe, hey, I got it. I wanted to make sure you got it for us. Okay, so why is the fall considered peak asthma season for us?
So really August through the December time is really critical for patients with asthma due to the heightened exposure to seasonal asthma triggers and increased risk for asthma attack. But really the third week of September is what we call asthma peak week, and that's when emergency room visits and hospitalizations for asthma tend to be the highest of the year. Each fall, the Asthma and Allergy Foundation of America publishes its annual Asthma Capitals Report, and this ranks the 100 largest U.S. metro areas by how challenging they are to live with if you have asthma. And I think in Atlanta, where you are, I think you guys are ranked in at number 7. So definitely a place where people will have issues with fall seasonal triggers leading to asthma flare-ups.
And why do you expect, why do experts think rather that this is a dangerous time, a dangerous season for the asthma community?
With all the pollen in the air, whether it's ragweed or you've got mold with decaying leaves. Also in Cincinnati, where I'm from, there's significant shifts in weather patterns, barometric pressure shifts, weather changes. Also back to school, you've got a lot of kids going back to school bringing viruses and bacteria back to the household, which can trigger asthma. Increased pollution in a city like Atlanta, all those things can really trigger asthma and make it more dangerous. And when you really look at the amount of asthmatics in the US, about 22 million adults suffer from this condition, with about 9 million asthma attacks a year, with over 700,000 ER visits. So it's not something to ignore, and that's why we're really working with AstraZeneca and raising awareness about Peak Week, because we want patients to really get ahead and be proactive about their symptoms. We want to encourage your audience members with asthma to talk to the doctors now, review their treatment plans, and know what to do before these spikes and fall triggers occur so they can reduce their risk for having a flare-up.
Yeah, so important to be prepared. You kind of alluded to that. What are the more common symptoms people living with asthma should be looking out for?
People with asthma often present with shortness of breath, chest tightness, wheezing, and cough. And all these symptoms happen when the airways are inflamed and when they're tightening. And so it's important to understand that both airway tightening and inflammation coexist and cause a lot of these symptoms. And so it's a challenge when you're constantly exposed to all these fall-time triggers to keep that inflammation and bronchoconstriction under control. So at least in my practice, it's very obvious that this time of year can be bad for patients. And so we really go through all these triggers, maybe do some testing to see if people are allergic to certain triggers. So important to really work with a board-certified allergist, immunologist, or pulmonologist if you have asthma, to make sure you have a good treatment plan. But fall allergens can be a nasty trigger, and it's important to really work closely with whatever doctor you're seeing to make sure you have a plan in place to protect yourself this fall.
Absolutely. And how important is it to track the daily pollen counts and the mold levels that you mentioned? What's the best way to do that?
So there's lots of resources online that you can go to track pollen counts and all that. Understanding, again, if you're truly allergic or not is important first. So getting allergy testing if it's appropriate. But it's important also to talk about what treatments are available too. So you can try to prevent attacks, but if they do occur, it's important to have a plan in place. And we do that with both daily treatments, like daily inhaled corticosteroids, but also just regular old rescue treatment. And in the past, we've used traditional rescue inhalers that just work on that tightening of the airway. And what we've realized over the years is that if we're not treating the underlying inflammation, just treating the tightening might not be enough. And so it's really important to address the root problem of asthma and address that inflammation with a rescue inhaler that has anti-inflammatory properties. And so if people are interested in learning more about what kind of rescue treatments might be appropriate for them, there's a site called modernageofrescue.com that's got great information about anti-inflammatory rescue strategies.
Right.
So I encourage your patients, your audience to really look and get a better understanding of how they can better treat their asthma by working with their physicians.
All right, Dr. Justin Greiwe, we appreciate you. Thanks for joining us this morning.